Yeah. Okay, yeah, do not disturb. Hello. Yeah. Good evening, everyone. Can you hear me? Okay, can you hear me? Just comment. Can you hear me? Alright. Can you hear me? Okay, while we are waiting, this is meant to be a test to ensure that everything is working fine. So if you can hear me, just drop a comment. Can also help me check if it's audible. Is it audible? All right. So while waiting for every other person to come on, we're going to start with the basic question that you should also have an answer to for you to be here. And it is, what is IVF? And IVF simply means in vitro fertilization. And in vitro fertilization is fancy way of saying we take the egg, we take the sperm, whatever we are doing, we take it out of the body and we are going to start the process elsewhere. In this case, elsewhere refers to the lab. That's what it is. So instead of the egg being in the woman's body like it's meant to be, or the sperm being in the man's body, and the man comes saying, while you are having sex, everything is going quite good. At that point, he ejaculates, whichever term you want to use for it, he comes, he pours, any of those things into the woman's body. Then the sperms, which are actually millions of them, starts a very intense race, which is the race that everybody's saying this now had to win. I myself, I did. Someone else, you, they all had to win that race of getting to the egg first. Upon getting to that egg, they fertilize the egg and the whole process of conception begins. That is the natural process. In the IVF process, which is not unnatural, it's simply assisted reproduction. In the IVF process, what happens is we are collecting this sperm from the man's body, we take it, the man produces for us on the day of the procedure. In the woman's in the woman's case, we give her some medication, she produces a lot of eggs for us. Then we take those eggs out of the woman's body, take it to merge with the sperm, and development starts. We allow this egg that is there to develop for a couple of days. After developing for a couple of days, then can you still hear me? Okay, just check if you can still hear me. Okay. Yeah. After allowing the egg and the sperm, which have now become an embryo, to develop for some days, the next thing we do is we transfer this egg, this embryo, into the woman's body. That's what we do. That is the process of in vitro fertilization. Now, while this may be a rather straightforward process, it is also quite complex because it requires a massive interplay of hormones to actually create that embryo to get to that point. In fact, it's the reason why you find that we start with doing what we call a stimulation protocol for the woman. There are different kinds of stimulation protocol. It's not really what is within the purview of your own, it's not within within the purview of what you need to know, but it's what your IVF clinic is going to be doing. They're going to be carrying out a stimulation protocol. There are different types, agonists, antagonists. That is not for you to start bothering about. Your clinic is ideally going to use the protocol that is effective, like we do. We follow a protocol that has given us successes. Protocol that have better triplets, quadruplets, twins, many fertility, many babies, babies that women over the age of 50 have gotten, 55, 50. I think our oldest pregnancy currently was a 56-year-old woman going to 57. So that is what we have achieved. By achieving that, we're able to refine our protocols over time and kept on refining. Now we still keep on refining with every cycle to get to the point whereby we have an optimal protocol that can give us hopefully one day 100% success rate. Because I do believe that it is actually possible to get to the point where IVF achieves 90 to 100% success. Yes, we are not there yet, unfortunately. I believe that medicine is coming to that point and we'll be able to get that soon. Well, so the stimulation protocol goes on for a couple of weeks, depending on what the person needs. For most people, your stimulation protocol can run from about, let's say, 6 weeks is a total of 6 weeks, 3 weeks into broken into two parts. But there are also special cases that actually require to hormonal modulation that runs for as long as 3 months. It's actually possible. What you need to do is meet up with your doctor, ask your questions, and they will guide you on what you need. After your stimulation protocol is done, then we do what we call the egg retrieval, which means that these eggs that we have given you medications to boost are now taken out of the body to retrieve them for that development I was talking about earlier. After taking them out of the body to retrieve them for the development, you go to the next point, the sperm, the union as occurred, is transferred to the woman, and you wait for a period of 2 weeks. In actual developmental phase, at about 10 days, the hormonal production of the embryo and the interplay that's happening in the woman's body can actually allow you to test for pregnancy, but we'll wait for 2 weeks as it's a better timeline, and you're almost very sure that if there's a pregnancy at 2 weeks of gestation, you can test and find that that woman is pregnant or not pregnant. So that is a basic overview of what IVF means in, for you to see. Then we will immediately launch into questions. And the first one here is from, okay, let's say it's Mr. Dio says, hello, my wife is 47. Can IVF still be possible? The singular answer for that question is yes. That is the singular answer for that question. IVF is still possible at that age. However, there are underlying things to that particular question. So let's just look at a number of factors that come into IVF, its possibility, and its success. The first thing that can be a major determinant of IVF success can be the quality of the eggs, the quality of the sperm, and endometrial receptivity of the woman. What do I mean by this? If a man has azoospermia, there is no sperm whatsoever, and you want to do IVF, is IVF possible for that man with his sperm? It now depends on what the cause of that azoospermia is. If it is such that there is no blockage, the person is actually not producing enough sperm, then IVF is only possible for that man with a donated sperm. However, if he's having azoospermia, but that's that azoospermia is caused by blockage in the passage of the tube, so the body actually produces the semen, but it does not progress, then that person can still get to do IVF. That is one thing to look at. That is when we talk about the sperm aspect. Then, if you are looking at the aspect of the lady, how when you one of the things there is usually air quality, quantity, endometrial receptivity, age of the woman. A woman at 70 years theoretically can still do IVF, but will not readily do IVF for that person. Often as above the age of 56, they're about 57, the chances of success can be so affected that you come on to say let them go for a surrogacy rather than an IVF. But in this age of 47 on its own, it's highly likely that menopause is already occurring. There is no semen, there's no longer um, there are no high quality eggs any longer. This person may not be seeing the menses and all of those paraphernalia that comes with menopause. If that is the case, then to do IVF for this lady at the age of 47, we need to start having a conversation of a donated egg. That is one. Two, if you take out the factor of age, what is the state of this woman's womb? There are people, for example, that have had medical conditions that meant they had to have their womb removed. That means this person can no longer carry a pregnancy. Whether she happens to be 25 years of age, she happens to be 35 or 47, then she can't carry a pregnancy any longer. It will have to be someone else carrying the pregnancy for her. because there's no womb in which the baby is going to develop. That is the basic answer to this. Then, wait a minute, let me just do this. Okay. Okay. So that is the basic answer to that. But in the way that you're asking, I believe you're asking from the ground point of age as a factor. I'm assuming that your sperm quality is okay. I'm going to make an assumption and guess that at the age of 47, your wife is going to be and based on then I would say that yes, your wife can do an IVF actually. Your wife can do an IVF. But there's a high chance that what she's going to be needing is a donated egg. And that is the only way you're going to get the IVF success. Now, let's move on to the next question. Say, where is your location? Currently, I'm speaking to you from Bori Delta State, Nigeria, at First Rank Hospital. That is where I'm speaking to you from. However, I'm also affiliated with two other facilities at Port Harcourt and Abuja. So you can actually access IVF care from here in Warri, Port Harcourt, or Abuja. Those are the places for now. I'm working on one in Lagos at the moment. So if that one comes into play, we'll see how we can get that across to you. But essentially, what you can do is reach out. Okay, let me drop my contact here so that you can reach out to me after this if you don't have my contact. But being here at this time, I presume that most of you here would have my contact details on WhatsApp. Let me see. Okay. Okay. So uh, I'm dropping in the in the chat room how you can reach me on. Um, all right. Yes. So when you reach out, we see if there's a location near you and guide you on how you can do your IVF. In all sincerity, distance is not a barrier. Location is not a problem. We have patients that were in the UK, they came down for the IVF, they've gotten their success, they've gone. We have patients that were in the US, we've had from France, from multiple places actually. People have flown in from different countries around the world to have their IVF done. The way we usually would navigate IVF, the procedure, if there's distance involved, is to commence with an online consultation. So you don't have to come down from your country to begin the IVF. After commencing with an online consultation, whatever test results we need, whatever tests we need to be done, we'll communicate them across to you. You do your test where you are, send the results back. When the results are available, we will now know what does this person need. By knowing what this person needs, we can now move on to the next point, which is preparing for the IVF process. In the For the person that is going to be undergoing a 6 weeks protocol, okay, Mrs. Rachel, I'm coming to your question. For the person that is going to be undergoing a 6 week protocol, the first 3 weeks are medications that are taken orally, which means you swallow them. And in that case, it can also be waived to you and you can commence them or you come for a sim. Most people actually need to see where they are doing the IVF. So advice coming for a first visit, we evaluate you ourselves aside from the results you have sent, and then you can go with the medications, you take them for the period of time, such that you only come down to where we are for the last 3 weeks of the procedure for most people. However, there are a subset of persons that will only need them for the last 1 week of the procedure, which is the way we use to navigate distant patients. And with this, distance does not need to be a barrier to getting your IVF done with us. Okay. Then with that aside, so that as I've answered your question about the location, then the cost of IVF in a clinic and a hospital. One thing you should know about the cost of IVF is that it is not fixed for everybody. There are different variations of IVF that can be done. Yes, you have a basic understanding of IVF as a singular thing, but it is not because IVF is a singular process or a singular practice, but the process even varies. But there are different combinations that can happen. For example, a man, okay, this conversation we had about the person that is 47, she can't use her eggs, it's a donated egg that she's likely going to use. That is different from the person that can use their own eggs, which is also different from the person that has issues. So you have azoospermia, you don't have sperm, you don't have any live sperm there or anything that is viable, then it means that for your own IVF procedure, we are considering a donor. So whether there's a presence of a donor or the absence of a donor will affect the cost of your IVF. The other thing is location. And most of our facilities, the cost of IVF ranges between 1.8 to about 2.5 million naira for the IVF process. That is the basic cost for most persons. However, something that may also come into play is when you consider these donations and the need for some men that have low sperm count, for example. Okay, let me deviate a bit into the situation of low sperm count because a number of people actually experience it. For men that have low sperm count and they want to do an IVF, there are a number of options that we have for them. They can come in and the very first thing we try is medications. If medications are okay and they have a boost in their sperm, they may pregnate their wives and move on from there. Other ones, medications are not enough. We have to collect the sperm from them, wash the sperm, and then after washing the sperm, we transfer it back into the woman's body at a time whereby we have stimulated her to produce a lot of eggs, which is IUI. Here's the question someone asked: difference between IUI and IVF. So I will come back to that. I'll try to come back to that. Then that is that. Then we move on to the IVF situation. If after giving the woman medications and you are getting to the next point, you see that the sperm has actually gone up and you can use it for an IVF, then we can do IVF with that semen, that sperm as it is. But there are some people that you cannot still use the sperm like that. But we can use the sperm, but we now need to do a special procedure called ICSI. In that procedure, what happens is we are collecting this sperm, we are preparing it, and we are going to collect a very good one of the sperm, one that is very good, is healthy, is looking chromosomally okay, anatomically is looking fine, morphologically is okay, and we are going to inject it directly into the woman's egg. So we're not in the normal IVF process. You place the egg here, you allow the sperm to swim around it, and one of them is going to eventually penetrate it and fertilize. In this situation, we collect the sperm ourselves and inject it into the egg for the fertilization. Every one of these things I have mentioned means a different cost. So the best way to know what the cost of IVF will be for you would be after you have been screened, you have discussed with your doctor, and you know where you are going to. So now I've said about 1.8 to 2.5. That is one. Then the second thing that may also affect the cost of IVF is your location. These ones I've spoken of, this price, this cost I've given you now is the cost with us. If you are there are places I know that somewhere in Lagos, one of the clinics that I know that's with the cost of IVF there is about 4 points, some about 4.1, 4.2 million naira for a basic IVF. I've known of clinics that it costs about 10 million naira for a basic IVF. There are a lot of factors that come into play when it comes to the cost of IVF. That is what you should know. That is what the fact is. Then the other thing about it is that at what time are you doing your IVF? A lot of persons like to wait for promote periods to do their IVF, which I understand based on the situation of the country. Okay, Mrs. Charity, we'll come to your question soon. Which I understand because with the nature of the way the country is, it makes sense to want to optimize for a time where you are going to get the cheapest cost. So if you are doing IVF during a promo period, it's doing different from if you are doing it outside the promo period. For example, the center that I'm affiliated with in Abuja now on the promo period, and it costs about 1.8 million naira to do IVF there. However, on a normal day, the cost of IVF there will cost me over 2 million naira, closer to the cost of about 2.3, 2.5 million. If you're able to do it within this period, which is for this coming month that we're getting into, the entirety of it, you will do it with about a 700,000 naira difference in the cost of your IVF as opposed to the regular cost of IVF. So these are some of the factors that come into play when considering what is the cost of IVF. Then moving on to the next question. So can a person with multiple fibroids inside the womb go for IVF? The size of the fibroids, the location of the fibroids, And okay, okay, okay. The size of the fibroid, the location of the fibroid, and also the effects of the fibroid. Let's start with the size of the fibroid. Fibroids tend to have different sizes. There are some that are very small, there are some that are very large, there are some that are medium. They usually, if you've done your scan, you'll find that they will tell you it's measuring 999 millimeter, or some will go as far as saying centimeters. You see those kind of numbers there. The it is in fact, so I want to make a point before we go further. It is not unusual to find fibroids in a woman's womb. Up to 50% or more of women have been found to have fibroids. It does not necessarily mean that they have an issue because they have fibroids. The fact that fibroids are there does not mean that they are going to have difficulty getting pregnant and delivering. I've had deliveries where the woman had what we call a coexisting uterine fibroid, which means there was a fibroid growing in the womb with the baby. For some women in that kind of situation, they get pregnant but they keep on losing the pregnancy because the fibroid is disturbing it. There are others that will take that pregnancy to term, get pregnant multiple times and deliver, despite the presence of the fibroid that is actually there. But if the size is very large, it means that that woman's fibroid has to be removed because very large fibroids are likely occupying the entire space of the womb. The size of the womb for a woman, if you are hearing me very clearly, well, what you can do is just take your hand up and make a fist like this. This ideally should be the size of your womb. But if you have and you can see that this is not very large. This is not a very large dimension. But if you have a fibroid that is making that womb to become extended, which are those women that you find you probably had heard about them or you've seen them, or maybe you are one of them. You have a situation where you have been having your stomach has been expanding. At first, you thought it was pregnancy, but you were still seeing your period. And next thing you go for one traditional place, they'll tell you, okay, Mrs. Radiant, can you hear me? Or I don't know if it's a Mr. or Mrs. Radiant. Great. He said, hello, can you hear me? I've seen your question. I've gone over it before, but I'll cycle back to it because you're just coming in maybe towards the end where more people can actually hear. But let's go back to the fibroid situation. You are experiencing your stomach getting bigger, you're still seeing your period. You go to one at the medical home, they'll tell you, oh, it's a cryptic pregnancy that they cannot see it on scan or whatever. But you go to the doctor tells you you're not pregnant. This thing is actually something. Some they will actually be told that there's a fibroid. That kind of fibroid that can grow to that size, that can be so big for some of you. Yes, you're not thinking you're pregnant, but if you just use your hand to massage your stomach, as below your just below your stomach, as if just above your waist, so to say, in front. If you use your hand to massage there, you find that you are feeling some hard substances. They are strong. If you are feeling those kind of things, it means your fibroids are likely large because your womb is supposed to be below your waist. You're not supposed to be able to feel it at all. So if you can feel those substances, it means that that fibroid has made your womb size to be like the size of a woman that is 3 months pregnant. We call that 12-week size. If it's getting close to your navel, you can see it there. It's already getting to a woman that is about 27, 28 weeks pregnant, which is too large. That kind of fibroid has to come outside. If it's that large, it has to come outside. What you should mostly know is this: listen to your doctors. This is why you need to use clinics, doctors, and professionals that you trust. If you trust your doctor and your doctor advises you, now the best thing to do is to take out this fibroid before going for your procedure. Then listen to that. We are trained. Yes, of course, there are some unscrupulous human beings across all professions. The way they are um, mechanics that are going to cheat you, electricians that are going to swindle you. The same way, yes, there may be doctors that can do that, but our ethics of our profession means we do what is best for you. For example, because of the fact that you are seeing me on an IVF platform and you want to do an IVF does not mean that will definitely do an IVF for you. What it means is that we will evaluate you to see if an IVF is the best option. And we've had cases like that where the person comes in thinking they need to do a procedure, they need to get medication. We'll say, "No, that is not what you need. With medications, you can get your pregnancy. With a less expensive procedure, you can get your pregnancy. With this kind of thing, you can get your pregnancy. Yeah, we'll do that. But if that is not the case, I will tell you that you need to remove this fibroid, then it's likely true that you need to remove that fibroid. If you don't trust what that doctor is telling to you, seek a second opinion, because the longer you leave them, the more damage you can cause. That is one. Then, aside from the size of the fibroid, which I think we have exhausted adequately, the next thing is the location of the fibroid. A woman's womb is designed like a, think of it like a ball, like this, but out of each end of the ball, there are pipes connecting to this ball. There's a pipe on the right here, there's a pipe on the left, there's a pipe in this bottom part. So here there's a pipe, here there's a pipe, at the bottom there's a pipe. Sometimes fibroids can come, block any of these pipe roots. And it's not a big fibroid. It can be a small one, but it blocks these roots. If it blocks these roots, then it means that sperm cannot come in to meet with the egg. Or it may mean that the egg cannot come in through the ovaries back into the woman's womb to meet with the sperm. And if that fibroid, no matter how small, is at those locations that is causing blockage to the tubes, which are called corner fibroids. If that is what is happening, then that fibroid needs to go out, even if it's a small fibroid. If a woman has a fibroid that is in a location that generally should not be problematic, but you have exhausted all testing options and found that there is nothing wrong, and that fibroid is likely above the size of 4 centimeters or more, it is possible that it may be a cause of the issue as well. So those are some things that you have to look at before. So there are women that we've actually done IVF for with the fibroids in their womb and they have gotten pregnant because the location, the size, the number, all of this, the effects are not enough to cause a delay. But there are women that we've also told, do your fibroid surgery first. Take out, I have a mother now. She's a mother of twins today. Before doing her IVF, she had to do 3 surgeries. She did 3 surgeries before doing an IVF. She had an ectopic pregnancy, which means a pregnancy that was there but was not growing in the womb. I was growing outside the womb, inside those pipes I was talking about earlier. She had that, and they had to do the surgery and cut that tube. She had what we call an ovarian cyst, which means that there was something growing in her ovaries. Ovaries are like the egg bank of the woman. So there was something growing inside the ovaries, and they had to do a surgery for that. Before having multiple fibroids that were so much, there was no option but to go in and take them out. After doing this surgery, we waited for, okay, okay, Mr. Kene, we're coming to your question. All right. So after doing that, it was time for the eye because when you do a fibroid surgery, you cannot immediately go in for your IVF. We have to give your body some time to heal. There are different schools of thoughts on this. Some will tell you wait for 6 weeks and the woman can get pregnant before she's 12 weeks. We will up to wait for about 12 weeks, which is about 3 months, to allow you to be adequately healed, except in some kind of situations where you can also opt to go earlier, depending on what we see on the evaluation. Everything in fertility, everything in IVF is going to boil down to your evaluation. So we do that and then we go for the fibroid surgery. So for this lady I was telling you about, when it was time for the fibroid surgery, sorry, my apologies for that. When it was time for the IVF to be done, what we saw was that she had some other fibroids growing back again, which some people do experience. A lot of people, you take out their fibroids, that is the end of it, but there are some subsets of persons that the fibroid may actually come back again. For her, what we saw was that there were some fibroids there. But because the fibroids were not so large, we went ahead with the procedure. And today she's a mother of twins. Luckily for her, it was a boy and a girl, despite the fibroid. But we still had a patient quite recently that was ready to do her IVF. She came in with her money, wanted to do the IVF, but we told her you have to wait. First of all, we have to take out this fibroid because if you don't take them out, because of what they are doing to your womb, which is they are blocking the part that the baby is supposed to stay, which is somebody asked a question about an endometrium being corrected. An endometrium, the endometrium being corrected, so those are some of the areas of the womb. So it was blocking those areas, and there was no way she was going to carry the pregnancy. The fibroid, she did her surgery, she did her surgery, she has done an IVF, she's not pregnant. It depends. Let your doctor advise you. Listen to the advice. If your fibroid needs to go out, let it go out. Think. Mhm. Okay, so that is an answer to that question. So it's not just about whether it's inside or outside the womb, it's about the size of the womb, the size of the fibroid, the location of the fibroid, the effect of the fibroid. Those are the three major things that affect the ability to do IVF with fibroids or not. Then, okay, how much is IVF now? I'm leaving this question once again towards the to the end of the session because we've gone over it before. It's a question that most people want to know. Gone over it before, and we're going to come over. We've gone over it before, but we'll come over it again. I think I'm beginning by about six. Gone over it before, and we'll be sorry. No, it's one or two things still have to be sorted out despite being here. Yeah. So, how can a teen endometrium be corrected when one is not major following for IVF? This question, I find this question to come up usually at the point of menopause. If the cause of the teen, if the cause of the teen endometrium is the question, that is the underlying issue. If it is a menopausal woman, by menopausal I mean a woman that is no longer seeing her menses. For most women, they will experience menopause above the age of 40. A large percentage of them above the age of 42. Even greater percentage by 45 going on to 50 years of age, they would experience menopause, which means the pause of menstruation to follow what is in the word is. When that occurs, something that is going to also happen to the womb is that the size of the womb begins to reduce. The size of the womb reduces, and not just that, the endometrium and all of those things are going to become thinner because during your period of say during the time where you are seeing your period, your body is consistently producing hormones. You have three periods of hormones as a woman. We have proliferative, follicular phases, those are phases that are not for you generally, but you can actually study up on them to know what they are. But these are the three phases a woman proliferative, the follicular, the luteal phases. During this year, as you're experiencing menses, your body is consistently growing through the cycles. At a point, your endometrium will grow. At a point, it's going to stop growing. There's no pregnancy. It will start shedding, which is the period you see. All those things that are coming outside the blood, within there is also the endometrium. When you are young, the body can produce hormones to consistently maintain this cycle. It keeps on going on over and over and over again. However, a time comes, which is the menopause of the woman, where the body does not go through the cycle anymore. The body does not produce the hormones that will maintain the breast, which is why you see very young girls, they have soft, round breasts that are standing. As they start growing older, it starts going down. You see women having regular periods as they are younger. In fact, they are crying every month because, oh, why am I going through this? But as they start going and start going older, the first of all, it starts skipping, then it stops. Something that will also happen alongside this is the shrinking of the size of the womb and the thinning of the endometrial lining. When this occurs, do not be deceived. I know that there is a desire to say that if it is corrected, then before you can go for IVF, it is not so. When you are going for your IVF procedure, so long as you are not above, yeah, there are certain limitations that may limit us from prevent us from being able to do something for you. But let's say you are 52, for example, let's use that age, and or even 50, you stop seeing your period and you want to go for IVF, you'll be given placed on some hormonal medications. These medications are going to help your body to start coming back into a state that allows you to feel that it makes your womb. The drugs we give, they do three things. One, it helps your body to come into a state of pregnancy, to so say. It's as if your womb prepares for pregnancy by kind of getting pregnant in a sense. So that when we transfer those babies, which is the embryos, but for easier understanding, I'm going to use babies for them. When we transfer those babies into your womb, it can now develop there and stick. That's what it is. And for women that are going menopause, you can still do this and go for your IVF successfully. However, if you know that you want to start your IVF in 3 months, in 6 months, but you don't have the money yet, but you want to start preparing in a way to make your donation better, there's also a school of thought that is by allowing us to stimulate your hormones regularly. So you see we stimulate you, you see your menses. You can do this until you are prepared for your IVF if you are menopausal, usually for about 3 to 6 months. It also helps to possibly increase the chances of success. One thing you should know about the IVF world is it is still a new discipline. A few years ago, if you had difficulty getting pregnant and we have tried medications, that is the end of the story. You can no longer get pregnant. We have to support you emotionally. We have to have discussions about, okay, okay, Mrs. Patient, I'm coming to your question as well. We have to tell you that, oh, that's the end. You have to consider adoption or other things. But nowadays, it is not so. The procedure has advanced from where it was before. We can now support women to get pregnant despite the fact that they are menopausal. But there are still some limitations in everything. Then, okay, so that's the answer to your majority. Be it to go to the hospital, let them evaluate you. If you are at certain ages, there are certain factors in place. You can actually be hormonally stimulated during your IVF procedure, not before, and you do a IVF and get pregnant. Okay, welcome. IVF pregnancy and delivery time. In fact, this leads us to two questions. One of them is you will hear that all IVF babies have to be delivered by cesarean section. Have you heard this before? If you've heard it before, you can just leave a comment or say something. Have you heard it before? All IVF babies have to be delivered by IVF by cesarean section. It is not in it. It is not true. If you check on the channel, you see somewhere that there's a video I have here talking about 5 common lies about IVF. This is one of them. What actually happens is because of think about it. How many years have you or how long have you been trying to get pregnant? And then you maybe you're trying to save up the money for the procedure, you are trying to get comfortable doing it, you have not yet felt like it's time for you to do it. You are finally able to go ahead and do the procedure. You are pregnant, just like a couple I saw today. I told him congratulations, but I told him, okay, I told him that I was fasting from now till his wife is going to deliver, which is of course impossible. But I was joking because I was saying I was preparing for the baby dedication because I love IVF baby dedications. They're such a joyful time. It's such a big joyful time. All baby dedications are a wonderful time actually, but I love when I see the mothers happy, I see them smile. There was a baby dedication yesterday. Today is a Monday, so yesterday, yes, the mother was smiling. She was all joy. She came in and she was like, oh, and it was nice. I felt happy because that woman has come to her joy. And after spending that amount of money, taking that amount of time to prepare yourself to save up for this procedure, you are now pregnant. We don't want you to take risk with this pregnancy. I don't want you to take risk with the pregnancy. I don't want you to go to a funny place. I don't want to do any abdominal rubbing. I don't want you to start taking drugs that I don't understand or what kind of concussion that you got from somewhere. I don't want those things. What I want is that your baby, which we consider a special baby, especially in the terms that your baby is like an egg for us. We have to do everything in our power, everything humanly possible to ensure that you get your pregnancy and take your baby from pregnancy to delivery. And one of the things that we do is we usually opt for a cesarean section. The reason why it is done is because in delivering a baby, the baby comes through a narrow canal. You have you never wondered? I believe you must have. Before I became a doctor, I've had those considerations. How does a woman actually push out that big head from that small space? Have you wondered? How does that big head, that body, come out? How did you come out of your mother? There is a narrow passageway. Okay. According to your question, Mrs. Patience, I'll be there. There is a narrow passageway that this baby has to come through. Because of how precious this baby is to us, we don't want to risk that baby coming through that trauma. With a cesarean session, we can select the day. You can select the day actually. Select the day you want your baby to come outside, and we prepare you for the procedure. We do the procedure and we come out. All things being equal in an hour or less or slightly more than that, we're in, we're out. You are with your bundle of joy. But if we wait for the vaginal delivery, say you decided that you want to deliver like the Hebrew women, which I not say as a mockery to Christianity. I am a Christian myself, but it is not a necessity that that is what must happen. All deliveries, a cesarean delivery, and a vaginal delivery, are absolutely normal. So we opt for that controlled one that is likely to give us success so that you can go home with your baby. I have a mother that is carrying triplets right now. Is she going to deliver by vagina? I wouldn't want that to. It's ultimately a choice. We cannot force you. If you come and say we should do this, that is what we will do. But if you ask me, if it was my sister, because that is how I give my own advice, I tell you, if you're my sister, this is what I will tell you to do. But you can do this, oh. But if it was my sister, if it was my daughter, if it was my friend, this is what I'm going to tell you. If it was my wife, this is what I'm going to tell you. And what I will tell that woman that is carrying triplets, the one that is carrying quadruplets now, is please don't say you want to do vaginal delivery. Let us do a cesarean section and bring out all your babies for you, and you can go home happy. That is why they do a cesarean section for most of them. It's not that they can't. If they insist on pushing, they can push. If you hearing me today decide that you must push for your own, you must push out your baby, well, that is your choice. But it is the best to often go for a cesarean section. Then about the timeline of delivery, IVF babies, IVF pregnancies are as normal. In fact, see, there's nothing that you are going to take up on this. Remember this. All IVF babies are as normal as every other baby that is out there. They are strong. Their pregnancy can be for 9 months. In fact, yes, let's use 9 months because that is what you know as the actual duration of pregnancy, though duration of pregnancy is slightly longer than that. The pregnancy can be on for 9 months. They can they can take baby food. If you are the one that carries the pregnancy in IVF, you can breastfeed your baby. Your baby can take all vaccinations, can play like other children, can jump, can do whatever they want to do without any restriction whatsoever. They are not the ones that are going to become imbeciles. They are not the ones that are going to have problem with recalling things. They are not the ones that are going to have this issue or the other. Because in IVF pregnancies, they have one advantage that even unassisted pregnancies don't have. And you know what that is? In IVF pregnancies, we select the best embryos. In a normal pregnancy, what happens is in that race of life, where the millions of sperms are running, it is the sperm that gets there first that will fertilize the egg. That's the one that develops. Whether that sperm was good, whether it has chromosomal abnormalities, whether it has whatever, there is no input into it. That is the one that fertilizes first. That is the one that must develop. But in IVF, there's something that happens, and it is this: when we have collected those eggs from you, the woman, and we have collected the sperm from the man. We have taken them to the lab, brought these two things together, and the woman is we have taken them to the lab, brought these things together, and the pregnancy is ongoing. Sorry, and the fertilization process is ongoing. We allow it develop, then we grade them. We look at the development and we grade them. What we are opting for, what we want to put back into your womb, are the best growing eggs. So the eggs that we'll categorize as say grade A, let's use that the A grade eggs are the ones that are the A grade eggs are the ones that we want to transfer into you so that you can get pregnant. So they are even better because of the fact that we have this selection process in IVF. It allows us to give you even better babies. IVF is also a way where there's also a procedure that we can do pre-genetic implantation testing, pre-genetic testing in some places, PGT, where you can test this embryo, the baby that is growing, to see if there are any issues. Are you an SS individual? Are you AS as a couple? And you are scared of giving birth to a baby that is that is SS as well, and you need to avoid that pre-genetic implantation testing. Test to see if there's any issue. Anyone that has issue, don't put it inside. We'll give you the one that does not have issue. So they're as normal as everything. Yes, sometimes there are some women that when they are carrying their pregnancy to 7 months, there are issues and we have to deliver the baby. But it is same as women that did not do IVF. There's nothing different. Women that did not do IVF, sometimes they carry their babies, they have to be delivered earlier. We delivered a patient of a baby a few days ago. She was not an IVF patient. She had a pregnancy, a conception unassisted. She was pregnant and started having issues with her blood pressure. She started having what we call a pregnancy induced hypertension, which means that the pregnancy had made her to start having blood pressure issues. What did we do in this situation? We monitored throughout the period of the pregnancy, and she was coming for antenatal more frequently than other patients because we needed to monitor her closely. When she came in on the day before her delivery, we found that the blood pressure that she was having had become very high. It had been around the range of, I don't know if you know what the normal blood pressure may be, but usually the top part should be at below the age of, should be below 140, and the bottom part should be below 80. 90 actually, 90 is the upper part, below 90. Okay, thank you, see tomorrow. Below 90, that's what it should be. But she kept on having steady values of 170 as up. Remember that the upper limit 140, she's having about 170. The lower part was about 90 something, 100 thereabout. We placed her on medications, we are monitoring closely and we are tracking. However, it got to a point, which was the day she came in, that the blood pressure was over 200. The lower part was over 120. This is a non-IVF pregnancy. She had unassisted conception. But we had no other option in that situation after monitoring and seeing that our kidneys have started having an issue. We allowing more proteins to come out. So normally you should not even have protein in your urine, except maybe you just finish eating something like meat or protein, that kind of thing. And in her case, she was having one plus regularly, which we were aware of. She was having one plus of protein. That day she was having three pluses. Because we wanted to avoid the negative effects of that blood pressure, in her pregnancy, we had to opt for a cesarean section to bring out the baby. She has gone home. She is fine. Her baby is fine. Mother, baby, alive. Father, happy. Because that was her first child. It was her first child. And she was not young. It was her first child at the age of 38. She had that delivery. In IVF, it can also happen. There are some people that when we are monitoring the pregnancy, you find that there are issues. You will not wait and say, oh, let's say because we must take. No. Most babies over the age of 7 months, even in Nigeria, can survive. Some may require incubator care, some may not. But they can actually be less than that. 24 weeks can survive. In some parts of the world, a baby can come out at 20 weeks, 5 months, by your balance, and survive. So, yes, we would rather the pregnancy goes on till 9 months, which is 9 months by your count, 40 weeks by our count. We would rather your pregnancy gets to that point. But if it does not, we will do our best to ensure that you and your baby go back home and that you live after spending the energy, the money, the resources on this procedure, that you go out with your sources, which is what matters. That is the answer to that question. Okay, the next question: can one still go? Can one still? Okay, I presume can one still go around doing a normal business after getting pregnant with IVF? The straightforward answer to this is yes. Is yes. Remember what I told you before. IVF pregnancy is as normal as every other pregnancy. IVF procedure is as normal as every other procedure. So what does that mean? What does that translate into for you in the period of your pregnancy? A woman that has had sex with her husband and is trying to get pregnant, and the man has ejaculated, does she lie there in her house and not go to work the next day? She doesn't. She can have sex in the morning at 5 a.m., at 6 a.m., at 7 a.m., and go to work that day, and she will get pregnant. Some people can even have sex in the middle of the workday and get pregnant. Still, despite the fact that they had to go for the activities. And it's the same thing with IVF. After the implantation has been done, you can go about your activities. Yes, we don't want you jumping over the mountain, diving into the depths of the sea, battling with all of the craziness of life like that. We prefer you're in a relaxed state, you are doing controlled things, and all that. But you can do everything. You can go to your work to do your work, you can go to church, you can go to see your family, you can spend time with your loved ones, you can go out for outings. We don't want you doing anything extravagant or too strenuous, but we don't want you caught up in that because it's a pregnancy too. The things you are not going to do if you are pregnant without IVF assistance are the things that you are not going to do if you are pregnant with IVF assistance. We don't expect you to be fighting in the streets when you're 6 months pregnant. We don't expect to see you jumping around or doing certain things if you are pregnant. Why there are people just as it is for normal pregnancy? This is a very important point. The things that are obtainable in IVF, pregnancy that is unassisted will avoid is what a pregnant woman that is assisted will also avoid. And I think that answers that question satisfactorily, right? So you can do your IVF, continue your daily activities, and do everything you are doing. We have patients that come in from Asaba, Lagos, and different places for their IVF. They come in, they do their procedure, they go back. While the patient that was in the Port Harcourt decided that she wanted to do use the antenatal was still coming back. Wanted to use here for delivery. As I said, she was supposed to be came back for delivery. She came for the IVF procedure, went back to Port Harcourt after we transferred the baby to her with that same day. She got pregnant and delivered her child. Don't let those things be limitation. You can go about your normal business, but don't do anything that is excessively stressful. I think we are going to be circling back down to the question of cost of IVF as a point to which we run. Now, let me just check if there are any messages sent to me right now. I'll respond to them. Let me see. All right. Okay. 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 Please, doctor. Egg implantation and IVF, are they different? Okay. So I'm asking this question now. Please, doctor. Egg implantation and IVF, are they different? Egg implantation is part of the procedures of IVF. IVF is the general name that exists for the process of stimulating the woman, collecting the eggs, collecting the sperm. But remember, I said in IVF, we collect the egg and the sperm and take them to the lab for fertilization. After fertilizing them and creating and forming, sorry, we don't create nothing, we're not creatures. After fertilizing them and the embryos, and okay, I'm coming to that question. After taking them together and fertilizing them, the embryo, the baby is developing. We bring the baby back after about 3 to 5 days, depending on what it may be, back into the woman's womb. When we bring the baby back into the woman's womb, what happens there is egg implantation. That is what we call egg implantation, and it is a part of the procedures of IVF. Let see. Okay. It's part of the procedures of it's part of the procedures of IVF. So that's what the answer to that question is. So before we get back to this one, let me just answer the other ones that are being asked here. Okay. It said okay, drugs that you
Why
can
not?
take, any drug that you can take to get pregnant. The answer to that question is I don't know yet. We can only evaluate you to determine if there's any drug you can take. Some people, yes, they can take drugs for their situation, hormonal imbalance, PCOS, some other things, and they can get pregnant. But there's no way to know until you are checked and evaluated before we can now tell if drugs are what can help you or you have to go for an IVF. Okay. So the next question: how much is IVF and is there any refund? So this is a question that also comes up with what's the cost of IVF. I've answered before. I'll try to answer it again before we round off, which we'll be doing soon. But the matter of refund in IVF, it depends. When the IVF procedure is being done, it starts from okay. I'll be responding to this shortly. Let me just tell her. I'll respond to this next. I'll respond to this. Sorry. I'll respond to this next. Okay. All right. So I just lost my train of thought. Here was okay, refund. Yeah, it all depends. It all depends. And every procedure, like I said, is a suicide procedure. There are times whereby you're in the process of the procedure and you find that this person is having some characteristics that will make it unfavorable for us to continue. To continue with this procedure, with what we are seeing, this person is likely to have a failure. We don't continue with the procedure. We wait. We try to find ways to circumvent and fix that issue. For some persons, they will say, "Oh no, I don't want to do this IVF anymore." No, no. If that's the case, then you can get a battery for whatever we've before we get to that point. Wherever we've gotten up to in the spending of your money is what will be deducted. You get yourself back. But if you're asking for the case of a refund, should there be a failure in the IVF? That's not the case because in getting through the IVF procedure, you will have to have taken the medications. You will have to have undergone the procedures, the processes, and everything that is required to get to that point. Which means that the money you paid has been exhausted in doing all that. So there's no way to refund at that point if that is where you're asking for a refund. But if it is somewhere within the procedure, fine. If it's before the procedure commences, you change your mind. It's also possible to get a refund in some facilities. This one I'm saying now is dependent on facilities. Some facilities won't give you a refund. Some will. Depends on. Always ask the question before you commence your procedure while you are there with your doctor. Let's go to the next question. Is it risky for an hypertensive person? It is possible for an hypertensive person to go for IVF, get pregnant, and deliver their babies. And I tell this story with a patient in mind now who has hypertension before going for an IVF procedure, got pregnant with triplets, and delivered a baby. However, in people like that, they have a higher chance of having what we call pregnancy-induced hypertension normally. But because they're already hypertensive, they cannot have exacerbations of this hypertension. For some persons, they can just be on their basic medications and the blood pressure is still being controlled. But there are other persons that they can't be on their basic medications and the blood pressure will be controlled. Instead, what will happen is you have to add other medications to it. For some, if you now start moving from that one into other things like eclampsia, which is a complication that can arise, then you have to deliver the baby early. But it does not mean that it is absolutely a no-no. But we prefer and it is ideal that the blood pressure is being controlled before your IVF procedure commences. I think that has answered the question, ma'am. Yeah. Next question. Okay, so did you say collecting eggs from the lab for fertilization can a woman of 48 years still produce good eggs? Collecting eggs for fertilization from a woman of 48 years old is difficult. And the reason is because by the time you are getting to 48 or digits around, the quality and the quantity of your eggs have become largely reduced. A woman is born with hundreds of thousands of eggs when she's given birth, when she comes to life. Every month, these eggs that are being reduced from the moment she starts seeing menses and menstruation till the day she experiences menopause, these eggs are being reduced. Not just that, as she grows older, some of these eggs start having defects. They start having issues. If the baby is born with those eggs, they are likely to have some genetic abnormalities. So for most of those women, what happens is they have to use a donated egg. It's possible in the earlier phases to screen the egg to see if there's any issue, but that is if the egg can be produced in the first place. So that's when you check the quality of the eggs. You look at the nature of the woman's ovaries. Remember, ovaries are like the storehouse of the egg for the woman, and also factors in hormone production. When you look at this test, you find that the egg quality is not good enough for IVF. So for most people at the age of 48, we don't recommend using their eggs. They have to use a donated egg. Okay, so advancing this now. Okay, sorry, so let's just get through other questions. Okay, how much is IVF? So let's show this now. Okay, costs. All right, if you have questions, you can just drop them now because we're about round enough. I'm aiming to end this by 6 p.m. So I'm answering the questions as I see them, and I'm answering the cost of IVF again as the last question. Okay, the link is not working. Okay, but people are on. So okay, so now it's not a question that we're answering here. Okay, I want to do IVF and I'm 54 years old. I have not seen my menses in January. I have fibroid but small. So there are actually four questions here. She wants to. Yes. Okay, men they have sperm, they don't have eggs. So I believe that that's what you're asking about. It depends. There's this general belief in the society that a man's sperm does not reduce. A man to the age of 90 can still give birth. While that is true on face value, it happens that as men age, the quality of their sperm can also start depreciating. So the answer to this question about the man's sperm is alright. About the man's sperm is dependent on his test. He will have to be tested. Some persons are 60, 70, they have very good sperm. You can do your IVF with their sperm and they get pregnant. And then you get the woman pregnant. Some may not put in IVF to impregnate the woman. It all depends on what test does. But on surface value, the answer to that question is yes, it can still be effective if they don't have the issue before. For example, one of the questions that this person asked is, "Good evening, Mr. You're welcome. If you have a question, you can drop it so that I can answer it very quickly for you. Is my husband has low sperm count? Can you use his sperm to do IVF?" We may not be able to go into this in detail, but there's a video on the channel that has the answer YouTube here that has the answer to that question where I explain the different processes that can be done for a low sperm count patient to get IVF. I've also explained it on this video. I will run through it very quickly right now. If the sperm is low, the usually one of the first options lifestyle modification. Stop drinking, stop taking alcohol, do some exercise, do lots of fruits and vegetables. That's one. Two, take these drugs. There are different classes of drugs that we can use. That's two. Three, we collect the sperm, we wash it, we now carry it and inject it into the woman's body again, which is called an IUI. That's three. For IVF, maybe we cannot use the sperm directly because of how low the sperm is. The next thing we do is we do a special procedure called ICSI, where the sperm is collected and injected into the egg. That's four. Five is a donated sperm for the IVF. Those are usually the tiers of the ways that it can be done for low sperm count. Okay, I'm answering this now. I'm answering this now. I just answered this. So okay, let me say I just answered this. Just answered this. So that's like I said again, 4 years. Just rewind back a little bit of this when you're done. You find that I just explained the way you can use the low sperm count. So depending on the grade of low, depending on how low the sperm is, okay, depending on how low the sperm is, depending also on how it has responded to the medications that's been the medications before and all of that. That was really feel that one. So fibroid was small. I've answered that one before. Depends if it's very small. Depends on the location. How much is IVF for? I'll get into that. For 57 years old, 54 years old, I've not seen menses in January. That is likely menopause. We would likely be unable to use those egg as of now with medical advancement, but a donor egg can be used. Okay. No, it's 1 year. Okay, I think we will have to stop at this point. Close to 1 year, I got me. He said it's close to 1 year. I got miscarriages and I'm not taking it until now. The last lab I went was progesterone and collecting with HBS and the two almost years other. But she got infection until now, yet to conceive. 38 years old. Okay, we'll have to review. That's where everything is. It starts with the review. Is there any cause for the delay? If, as a couple that is less than 35 years old, you are meeting with your partner regularly, when we say regularly, we mean 3 to 4 times a week, and is ejaculating in you during the intercourse, and after a year, you are still not getting pregnant, come to the hospital. It means there's likely a problem. But no, that getting pregnant does not happen in just one month. Even a woman and a man that have no issues, the egg production is fed, everything is fine, the sperm production is top notch, everything is going okay, it can still take them, if they are a young couple, up to a year to get pregnant because humans don't get pregnant so easily. So it starts with the evaluation. Is there an issue? If there is, we see how we can help. If there's not, we see what we can do. Then there are other steps before IVF. IVF is not the only fertility option. There is the medications like we discussed before, the lifestyle modification, knowing your cycle. There's the drugs. There's IUI before you now start coming to IVF and all of all those things. For that one, like I said, in any way, any other way to get pregnant apart from IVF when a man has low sperm count, consider medications. You should stop smoking, stop drinking, healthy lifestyle. You should go to the hospital, be evaluated, probably do some medications. Medications can be changed. If those don't work, you can go for the procedure we call IUI. IUI in simple explanation means we collect the sperm from the man's belly, we wash it and prepare it so that the strongest ones are the ones that are there. We carry those strongest ones and inject it directly into the womb. So maybe the sperm is not able to swim to the womb before, we put it directly into the womb. There are levels of low sperm count that can allow us to do that, and the woman can still get pregnant. And for this lady, you should send me um, a message so that I can we'll discuss the evaluation. I think with that we can end there. Everything that is currently on promo. Okay. So everything that is on promo in Lagos. For that one, I will have to get back to you on that particular question. If I'm making a static point, really a worry is where the IVF clinic is. For the Ugly affiliation that you would have known, there is a clinic that was the foundation that was doing um, discounted fibroid surgeries for patients. So that's where what's happening in Ugly at the moment. Because for the second process of IVF, if the first one does not work, the second process of IVF, if the first one does not work, is dependent on the kind of process that is being done next, and depending on your clinic. For most times, you find that you have a discount on the second process if it's done immediately after the first process. So people can opt to say, okay, I've heard, which is what I advise my friends, my family, my loved ones. If you are preparing to go for an IVF and you can afford it, prepare your mind as though maybe the first one doesn't work and you're going for the second one. But it does not even mean the first one will work. The first one could work and you have the money. But some people will say, oh, I don't want to go through that fear, that pain of that bother of is it going to work, is it not going to work, and decide that they are going to pay for what we call 2 cycles. The cycle of IVF refers to the beginning of your medications to the end of your stimulation. Extensively, you can say till the test result is out. That is the cycle of IVF. It depends on your clinic. Have that conversation before you start, and depending on what the issue was, where it feels, those are the things that are going to come into play when considering you can how much payment for the second cycle is. Which will now bring us to the question of cost, which I think we are going to be ending this on right now. Cost of IVF is dependent on a number of factors. You cannot be categorically told that this is the cost of IVF alone. Okay, IUI, the second option, IUI. IUI depends on where you are. For most places, it will range between 350 to 550,000 naira. It can also range as high as a million, depending on where you are doing it or more. But IUI tends to be a more affordable option. But depending on certain ages, IUI is usually not done above some clinics tell you they don't do it above the age of 30, some 32, some 35. Because above that age, the chances of success begins to decline. Others will tell you that there are lots of considerations to be done actually before you can do an IUI. Are your tubes open? Is the sperm quality good? If it's low sperm count, how low? Are there fibroids? Are there hormonal things that can be affecting your ability to get pregnant in the first place? A number of those questions and more have to be answered before you can go for an IUI. Secondly, for an IUI, a single IUI cycle may be enough to get pregnant, but especially with increased age, lower the chance of you may have to repeat it again. So it's something that you have to weigh sometimes. But for most younger couples, we will try an IUI first, especially if everything is good, the parameters are fine. 35, you have the borderline age is good. You can go for your test, do your air quality test, which we call the AMH, anti-malarial pneumonia, that one we used to evaluate. So do your test. If the egg quality is good, your tips are open, the sperm quality is good, have a conversation with your clinic, and your hormones are okay, then you may be able to do an IUI. It depends on your clinic. This thing. Like I was saying before, it depends on certain factors for cost. So cost is going to be dependent on what you need, what the issue is, and all of those things that are going to come into cost. Depends on your location, we are doing it. It can be done for Us is mostly about 1.8 million naira to about 2.5, depending on if you are using your air, zonal air, extra procedures. But promo is currently ongoing in the Abuja Center, like I mentioned before, where the entire procedure, because IVF process actually is a stepwise, it's like building a house. You come for the first visit, you step to the clinic to do your registration, that's the first cost. Cost of registration varies for most of our facilities between 10, 15, 20,000 depending on the location you are. After doing your registration, you go for your testing. Testing depends on, have you done your test before? What is the essence of testing you need to do? Do we need to do some extra special procedures for you? Some people can spend less than 100,000 naira on testing and they are done with their test. Others can spend up to 200 or more and you need to do that because of what we see. That is the testing process. Then before now getting to the ending point, which is the IVF process itself, which is what now ranges between that 1.8 to 2.5 for us. There are definitely facility clinics that are cheaper. They do. But there are also facility clinics that are more expensive. For us, our cost is determined by what have we done that has given us success? Which medications have we used that have given us success? When we have this question, we keep on doing those things and refining for better success. So we are importing our medications and they have been giving us okay, and they have been giving us and they have been giving us success with this quality of medications. We don't say that because the price has gone up, we have to now stop using this. Let's go for a cheaper product. No, because the goal is success. Better to spend more as the better to make sorry, better to spend more and get success than to spend little and get failure. Because we want to be sure that what is causing your success, what affects you, is not the quality of the medications we are using. Instead, we are using good medication that are likely to give you success. If the progress is slow, you may want to have a conversation with your clinic about doing an IUI. You may still be eligible for that. For say the qualification, they say our problem is low sperm count and we have been taking medication, but the progress is slow. Have a conversation. You may still be a candidate for your IUI. If it's not, then they will tell you before you start thinking of other options. I think at this juncture, we can come to a close for this session. I will see if I can have some more time later to set up other sessions going forward. Thank you very much for your time. I'm happy to have been able to be of help in the way that I can be. I'm looking forward to your pregnancy. I'm looking forward to your baby. I'm looking forward to you saying, "Mommy," or hearing rather, hearing "Mommy," hearing "Daddy," hearing Junior, stop it. Why are you scratching the house? That's what I want. And my goal is to help you to get to that point. And I'm wishing you the very best. I pray that you get pregnant as soon as possible. But your twins, your triplets, or whatever you want to get location depending on where you prefer. For now, predominantly, I can link you to Lagos. Sorry, Lagos not inclusive currently. Port Harcourt, Abuja, and Warri. Those three places. If any of them is convenient for you, send a message. Yes, you can give birth normally. It's also explained before. Yes, it can be done in worry. I've done in worry. Just use this message or send me a message. You can do it in worry at give money around the airport road. You can do it there. So, like I was saying, if okay, it must be operation. No, it's advanced. So I've answered this during the course of this video. I explained it very fully. If about delivery with operation or delivery with banana delivery, so you can just go through this, watch it. You will see where I answered that this should be available almost as soon as we're done. I think let's just round up on that. Thank you so much for the time. In any going forward, another time so we have other sessions, I'll try to inform you before then, and we can also answer many more questions and see how we can go. Have a wonderful day, everybody. Good night.